Hello, everybody. Welcome. We are just going to wait a couple of minutes as people join us, and then we'll get started promptly. Well, it looks like we got 72 people online already, so let's kick it off. Well, on behalf of the Action Collaborative on Business Engagement in Building Healthy Communities, welcome to today's webinar, which is called From Healthy Communities to School Nutrition, a Company's Commitment to Its Community. I am Robert McClellan, who along with my colleague Margaret Guerin Calvert will be moderating today's event. We also serve as co-chairs of the Action Collaborative. Our mission is to catalyze and facilitate private sector partnerships and the actions of business, health, community, and public sectors to work together to enhance the lives of workers and communities by improving the nation's health and wealth. In case you may not be familiar with our collaborative, we are an ad hoc convening mechanism under the auspices of the National Academies of Science, Engineering, and Medicine's Roundtable on Population Health Improvement. So welcome to our event today, and I hope that you have an opportunity to look at our website and participate in future webinars and events as well. Today's speakers will be Kim Fremont Fortunato, who's the Vice President of Community Affairs at Campbell's, where she's also President of the Campbell Soup Foundation. Also joining us is Nancy Easton, who is the Executive Director and the founder of Wellness in Schools, and Kurt Ellis, who is the co-founder and CEO of FoodCore. I encourage you to look at the webinar's flyer for a fuller understanding of the depth of expertise and experience that these speakers today bring to bear to the webinar. So Kim will begin with some remarks about Campbell's 10-year investment in its community. Then she'll show a brief video introducing the continuation of the program. That will be followed by the other two speakers, and then we'll open the mic for Q&A and dialogue at about noon. Please use the Q&A function of Zoom. And if you do have burning questions, please enter them in the Q&A along the way. And if they are germane to understanding what has just been said, my co-moderator, Meg, will recognize you and be sure that we get that question answered. But please feel free to be entering questions along the way so that we have a queue of questions right at the time the speakers end. So with that, Kim, I'm going to turn it right over to you.
Thank you, Bob, and thank you to you and Meg for hosting today's event and for inviting us to join you. I'm really excited to be here, both with Nancy and Kurt, who have been longtime partners in the Campbell community work. The Campbell community work, since I've been at Campbell, which is 11 years now, began 11 years ago with a 10-year, $10 million commitment to measurably improve the health of young people in our hometown community of Camden, New Jersey, where Campbell has been for more than 150 years. Our outcome measures originally were around reducing BMI and also food insecurity. We pivoted our measures away from BMI to really looking at different health measures around nutrition, food access points, et cetera. And what we did 10 years ago, at the same time the first issue, the first article on collective impact was published by the Stanford Social Innovation Review, is we collectively framed our common agenda and our framework for the 10-year program and rooted our practice in collective impact methodology. Now, both FoodCore and Wellness in the Schools have been partners in that 10-year collective, FoodCore coming in year 2, Wellness in the Schools coming in year 4, and remained with us through the sunsetting of that program, which sunsetted in July of this year, of this current year. Lots of successes about that program. I'm happy to share plenty of learnings and opportunity to redo and readjust along the way. But I think one of the things that's most important about that program was the collective impact methodology. Campbell was unique in that we were not only the funder of this collective impact for 10 years, but we were also the backbone. And we were the backbone leader because at that time in Camden, New Jersey, there wasn't a community-based organization that had either the will or the capacity to do what we were setting out to do. We were really fortunate to be able to provide the capacity from Campbell Soup Company, as well as the $10 million of funding to see this 10-year program through. I think another important highlight is the private sector taking a 10-year view of something. You know, we operate in quarters. In fact, earnings are today at Campbell Soup Company. So quarters are really important. And the ability to say, here's $10 million and here's 10 years. The 10 years was really, I think, more significant. The $10 million is significant in that all of our partners, Campbell and all of the partners in the collective, leveraged more than dollar for dollar the initial $10 million commitment by Campbell. So we were able to have so much impact, I think, working in this public-private sector partnership with multiple partners, and really made some dents, I think, in the food system in Camden. A highlight is the Healthy Corner Store initiative, which now is up to about 45 corner stores involved in that program that represents more than 40% of the corner stores in Camden. And that initiative has introduced fresh produce, nutrition education lessons, screenings at corner stores for different health outcomes, double up couponing program. Lots of change has been made. And indeed, that program is now used as the sample example model for the state of New Jersey for corner store work. So that was definitely a success. Understanding supply and demand of food coming into the city, especially a lot of free food that's in the city, really helped inform some of our strategies along the way. Another success, I would say, was the initiation of really the first at the time, 10 years ago, citywide after-school sports program that afforded safe places to play in a city that at the time had a lot of safety issues. And not only safe places to play, but safe places with structured activity. But again, I think this notion of collective impact of partners working together was really one of the fundamental components of this program that has over and over again demonstrated the power of cross-sector partnership. And it was in thinking probably around year 7 about the sunsetting of healthy communities at the 10-year mark that we began thinking about more deeply about school nutrition, because school nutrition was clearly a part of the work of the Healthy Communities program. Both FoodCore and Wellness in the Schools will share some of the work that they did, both in healthy communities and now that they'll be doing going forward. I thought about school nutrition, and I thought about shared value for Campbell Soup Company. We are a food manufacturer. We sell and manufacture and sell foods that go into the K-12 segment. And I thought about what opportunity existed for Campbell to perhaps think about new product creation for school food while addressing an issue that I thought was a compelling issue, and this was pre-pandemic. That compelling issue, as we all know, has become far more compelling as a result of the pandemic. So we started planning 2.0, which is called Full Futures, and you'll see a short video about that in a second. Several years ago, 3 of our partners, FoodCore, Wellness in the Schools, the Food Bank of South Jersey, carried over from our Healthy Communities program into our Full Futures program, with the addition of 3 new partners, the Alliance for a Healthier Generation, National Farm to School Network, and Common Market. We are set up again as a collective. This time, Campbell is only the funder and not the backbone. FoodCore is providing that great role for us. And we are embarking on a whole new collective process, much more intricate and complex than the first 10-year collective was, and probably a lot more challenging to push the needle. But the idea is to create a blueprint this year that can be shared with anyone, other food manufacturers, food retailers, really anyone, funders in any community. We certainly understand that districts' needs vary district to district, but we do think that a lot of the strategies that we're focused on translate to districts across this country, and certainly the need to elevate the awareness and the dedication to a holistic approach to nutrition at every level within a district, it is paramount in today's world. So I'll pause there. I'll ask for, I think it's about a 21-second video, so it's quick, on Full Futures, to give you a little taste of what we're heading into, and then we'll turn it over to my partners. Thank you.
Great. I think we decided that Easton came before Ellis. On so I will go, or maybe it's ladies first. Who knows? But I'll go next. Thank you, Kim. That really grounded us in the big picture, which was perfect. So and thank you for having wellness in the schools today. Thank you all. It's always a real pleasure to get to talk about the work that we're in and day out, but we don't often get to reflect on it and to celebrate it. So I really appreciate this opportunity. So as Kim mentions, Wellness in the Schools joined the Healthy Communities Collective about midway through, and we're now part of the Full Futures program. And I will proudly share some of the bits of our experiences that are worth noting for replicability. I want to first quickly explain the lens from which Wellness in the Schools comes to this work at large, a lens that I think will resonate with this audience. We were founded nearly 20 years ago with the bold vision to eliminate obesity-related illnesses that begin in childhood. And we center this work in schools within the federal school lunch program, a program that serves nearly 32 million children, 22 million of whom live below the poverty level. And our premise is that we have a national meal program that is actually free to most children and also to their families during the pandemic. But unfortunately, there's no such thing as a free lunch because the majority of school cafeteria food is costing our country billions of dollars annually in healthcare costs. So we're changing that with freshly prepared meals and nutrition and culinary education that supports the systemic change in the cafeteria. Working in Camden is so crucial because this audience also knows that social determinants of health are real, that variables like socioeconomic status, healthcare, and access to affordable, nutritious food directly influence health outcomes. So given our perspective, we were brought in when the collective began addressing the school cafeteria and kitchen component in a larger way. Our work is centered in that cafeteria, where we review the lunch menu, make recommendations for changes to more freshly prepared meals, introduce concepts like salad bars, and then train the school cooks, not only on the execution and implementation of the new recipes, but also on the why of this work. Without a collective, we typically provide nutrition and culinary education to students and families, but in Camden, we've partnered with FoodCore and with the Food Bank of South Jersey for that educational tie-in. So I want to talk about something that's not exactly data-driven, but that I believe to be really the most critical component of the success of this collective work, and I think can be replicated. And that's the building of trust. And as Kim mentions, she's been doing this, and Campbell's has been committed to this community for over 10 years. So the trust building starts with Kim and Campbell's commitment and persistence. What she didn't tell you is that she's inserted herself and the Campbell commitment into the office, to the district office for years, oftentimes being met with resistance. But the fact that she continues to show up and that each time with a new set of experts and change agents is remarkable. And again, Kim mentioned that as a piece of the success. And it's the beginning of building that trust by demonstrating a true commitment. And Campbell's walks the talk. So the single most important aspect, the other most important aspect of the success of this kind of work is the willingness of the district to be at the table, to be part of the change. And today we are at that place. But it took over 10 years of Kim showing that she is committed, of her bringing together a collective, and of us then being on the ground. And Kim talked about that balance. The Wellness in the Schools team has spent now over 6-7 years on the ground. We've even traveled to Cincinnati together with the team to present to a standing room only group at the National Farm to Cafeteria Conference. We've traveled as far as the Campbell's headquarters in Camden, New Jersey, to train school cooks on culinary skills in the Campbell's kitchen. We made chicken sabroso with the Campbell staff and with the school cooks, the Camden City school cooks. And most importantly, we've been in the trenches, in the school kitchens, all over the city of Camden, using our skills and experiences to make the meals for children more delicious and nutritious.
Nancy, if I could just follow up, you had a very timely question that I think you in part have answered already, but can you share any other factors about how to bring fresh food in to be cooked where a school might not have the necessary equipment or the space?
So there are various models. There's a central kitchen model where you can do a lot of the prep or the pre-prep in this central kitchen and then bring it in. But we also, because our staff are chefs, and we're very deliberate about hiring skilled chefs, we are able to translate recipes that can be made on one induction burner or with just a combi oven. We can boil water and make pasta in oven if you don't even have a burner. So we can adapt for kitchens, but one of the more traditional models is to use a central kitchen.
Thank you.
Sure. So I was talking about us coming, what we did during the pandemic. And Kim mentioned that FoodCore is the backbone, but during the pandemic planning, we spent every single month in the pandemic in regularly scheduled meetings with all of our partners and the donor and the district leadership at the table. And while that might sound sort of normal, in the 15 plus years that I've done this work, it's extremely rare. And that work, maybe we all just felt sort of rewarded that we were doing something that felt rewarding during a time that was so difficult. But having all of us at the table was, not easy, but incredibly important. And again, rare. Finally, something that I think is really worth pointing out in this building of trust piece is the importance of representation. I think a year or two ago, we wouldn't have been having these conversations, but it's important to share that when we were preparing to staff for this collective, in my first meeting with Kim in a small cubicle at Campbell's, we discussed race and gender and the importance of our team reflecting the Camden community. The choice of Witt's leadership and of Witt's cooks on the ground was very intentional. And I believe it has helped us to break down barriers, to overcome resistance, and to get to the very important conversations that we're having today. Our head chef, who works in the new high school in Camden, he actually attended Camden City Schools. And that kind of familiarity is so crucial. So I'm actually looking at the clock, and I'm going to stop here because I realized that I went on this trust piece, but I do think it's so important. I have in my notes to talk about our training models, the salad bar, and the list of recipes that we've introduced to the districts, but we did allocate a pretty robust question and answer session, so I'll leave some time for Kurt, and if you're interested in those components, please do ask at the end.
Thanks so much, Nancy. Such a privilege to be doing this work alongside you. And Kim, thank you for the great introduction and for all your partnership. I'm so grateful to everyone on the webinar for joining us and the National Academies for helping to make this forum possible. I'm the co-founder and CEO of a national nonprofit called FoodCore. We connect kids to healthy food in school. Our work plays out with an on-the-ground presence in communities in 14 states, where we place AmeriCorps service members into the context of schools and districts that are ripe for transformation in ways that elevate food education and nourishing food in school. Our work as an organization is really around helping those communities define for themselves what transformation is needed and then providing the boots on the ground capacity to support progress towards those local goals. And then making the sum of those different pieces around the country add up to something greater than their individual parts. And for us, that looks like leadership development strategies. We have more than 1,200 alumni who have been through our AmeriCorps program, where they've had this meaningful experience teaching kids about healthy food and helping lunch ladies and gents and food service leaders make the change happen on their school meal menus, who then, the overwhelming majority of them, go into mission advancing fields at the intersection of equity, education, food, and health. In addition to that leadership development work that we do, we also do a meaningful amount of policy work, in some cases at the state level, where we're the right partner for that, and then certainly at the federal level, working on issues like advocating for additional funding for school kitchen construction so that more schools can make the kind of transformation that Nancy and her team at Wellness in the Schools are doing such an incredible job of supporting with remarkable partners like the Camden City School District. As Kim mentioned, we have been involved in the work in Camden since quite early on, year 2 of the initial Campbell's commitment. And our learning through that time was, first of all, how powerful it is when a coalition of organizations really start to come together with common interests, and how important it is to have a funder at the table, keeping people engaged and keeping us all leaning in on the front of our seats. It's a very sensitive position for a funder to occupy. And Campbell's did a remarkably thoughtful job of figuring out how to show up with the resources that we're going to kind of grease the wheels of all of us coming together without being an overbearing presence or forcing the work in a direction that those of us from the nonprofit side or the community side didn't think was actually strategic to us or our collective goals. In that kind of initial period, FoodCore really focused on how we could contribute to the collective's goals through our boots on the ground work. So we placed FoodCore, AmeriCorps service members into the context of KIPP schools, helping to do things like make the rollout of salad bars successful, helping to do things like taste tests and hands-on cooking and gardening lessons with kids. And we saw thrilling progress, the kind of kids at the KIPP Landing Square campus, where 75 to 80% of the kids would be coming back for second or third helpings of salad on the salad bar. It's a real testament to what happens when Nancy's team and the Camden City Schools are introducing the vehicle for kids to get access to healthy food. FoodCore is doing garden-based education and classroom-based learning and taste tests, getting kids the on-ramp into enjoying it. And then the impact is a shifted school culture where kids are actually eating healthy food every day and coming back for more of it. And that's just what we want to see. And as this next chapter of the work took shape, FoodCore has been really thrilled to step into the backbone role that Campbell's was holding on their own in the first chapter of this work. And our sense is we're in a good position to be able to foster the kind of open communication that needs to happen between partners behind the scenes, the kind of shared goal setting and shared agenda setting that actually puts us onto a path towards achieving a multi-year transformation together that is far greater than the change any one of us could have fostered as an individual organization or stakeholder. And then measuring the impact of that work and documenting what really works. And so working closely with the evaluation partners from Alliance for Healthy Regeneration on this initiative. And then really thinking hard about replicability. And Kim's point about this really intending to come together as a blueprint for how communities around the country can take their own agency in building food education and great food in school in a way that actually reflects the priorities and interests and stakeholders and cultural identities and values of that community. And that's what we're really after. So within FoodCore's work across the 150,000 students we reach each year, we are really seeing this model of the work happening in Camden as something we can learn from and begin to find pathways towards replication of that in other communities. And that really is a testament to the trust building that Kim and her team put in place. And it's a testament to the remarkable leadership of folks at Camden City Schools who have been coming to the table in this next chapter so strongly, day in and day out at an extraordinarily hard time in the life of our school systems. And it's a testament to what is possible when nonprofit partners kind of put their egos aside and actually center the mission we have, which is, in our case, fully about kids. And so how do we make sure every kid in Camden has the nourishment they need to thrive? That work feels really good when you're doing it in a way that actually puts the mission first.
So I think we're probably ready for Q&A. Is that right? Or do you guys want to say something more in your introductory remarks, any of you? Okay, it looks like we're good to go. It's over to you, Meg.
Okay, and there are a number of questions that have come in the chat, and I would encourage people to really continue to be asking those questions. But maybe just to get us started first, I think, Kim, to go to you, one of the things that I think everyone would be interested in, given your leadership, your 10 years, what do you see the impact of, I'll call it your program, your leadership over the 10 years? What's been the impact on Campbell's own employees and families? What changes has it brought about? And what's been the reaction of the shareholders, the stockholders, to the program and its impact?
Yeah, thank you, Meg. That's a great question, whoever asked that question. Thanks for asking it. First of all, the impact for us as our Campbell community internally, our employee community, I think it's a great impact, and I see it even more today with the launch of Full Futures, because there are so many people who are already coming forward to say, here's what we can do. So let me just give you a few examples. And these examples, I hope, will illustrate how this drives our company purpose. I mean, this is our company purpose coming to life. Our Healthy Communities and our Full Futures program both have youth advisory councils, middle school and high school students who advise our work. We also compensate them to do so. Just recently, both of the middle school and high school councils had online sessions with our R&D folks in our food service division to help inform the thinking of the R&D people around school food. Now, while this was informative for the R&D folks, it was also really meaningful to be able to talk to and really listen to Camden City students about what they're experiencing daily. So a little example of bringing this work to life with our employees. We will, especially once we're in person on a regular day-to-day basis, we will be adding employee experience and volunteerism on a skills-based from a skills-based point of view into this program. So our chefs, our registered dietitians, our IR VP, our investor relations VP, has been involved. So to speak to the question about how have our shareholders looked at this, of course, our shareholders and our board are looking at our ESG commitments, of which I'm responsible for part of the S in environment, social, and governance. And just recently, we were acknowledged by the New York Stock Exchange for our community work. And they actually made an ornament that said Camden, Full Futures Camden, and the benefit of any donations for that on the day that we were highlighted went to our backbone partner, FoodCore. So we are, I think, being embraced. This program is being embraced by employees at all different levels. And it really speaks to, again, back to our company purpose, connecting people through food they love. It really brings that purpose to life and gives our employees the opportunity daily to be involved in the purpose that we all think of, when we all as employees think of when we come to work every day.
Super. Thank you, Kim. And you've talked a great deal about the success and how it goes throughout the community and recognized outside. Kurt, a follow-up question to you that comes in on the Q&A, and also something that we have heard in the collaborative, is for takeaways and lessons for others. You talked about social determinants of health, other critical factors. Nancy did as well. As you look going to the future, but also a little bit retrospectively, and others can answer too, what do you think are your best measures of success? What are your success factors? And how have you and do you plan to track success going forward? You know, a $64,000 question.
Yeah, I mean, honestly, what I think is most important here is that the community that is at the center of the work has the opportunity to define success in the way that is most resonant for them. And it's tempting, I think, as a national organization and as national philanthropic players to say, okay, here are the measures that matter most to our lens. And we have a perspective that should be in the conversation, I think. But ultimately, if we want this work to be relevant to the communities we are working in, and we want it to make lasting change in the communities we're working in, then those measures have to be determined by local stakeholders based on what their lens is coming into the work.
And I can illuminate that a little bit based on the logic model pillar work that we did over this however many months of the pandemic, when we were not in schools. And as I mentioned in my opening remarks, having the district and the food service provider at the table to develop this logic model. And in the section around recipe development and procurement, some of their goals were to increase plant-based recipes, to increase recipes to address different dietary needs, to address cultural differences. So that was, to Kurt's point, working with the district, and our area was in this recipe and menu development piece, listening to what the needs of the district were based on their work. So those were just two quick examples. And we, you know, as Kurt said, yes, the nonprofits also have an opinion coming to this, and we always look at increased consumptions of fruits and vegetables and whole grains. But those were some that came directly from the district as we were preparing the logic model.
A great example, Nancy, and I think the distinction that it draws for me that is important here is we could be running a program, but what we're actually trying to do is shift a system. And when you're trying to shift a system, you have to analyze how that system is currently being operated that's holding it back from achieving the goal we have of every child in Camden being well nourished and set up to thrive. And as we dug into that work as a collective, it became clear the specific parts of that system that we need to focus on in that place. And they may look different in some other places, but in this case, the need to build a school nutrition mindset in a way that actually makes food recognized as a strategic priority in the education system, shifts it from being seen as a cost center to be minimized, and instead being seen as a value and impact center worthy of being unlocked. That was important in this context. Second, making sure that infrastructure was in place, that actually the equipment and more importantly, the staff training and resourcing was in place so that the school partners across the district could actually produce really healthy, high quality meals, and great food education could happen in a classroom and garden-based setting. Third, making sure that that nutrition education is being provided and kids have immersive experiential kind of engagement with food where they're smelling the leaves of a tomato plant and eating a carrot with the dirt still on it. That makes a big shift in what actually happens on the lunch line when kids see the change. And then lastly, actually shifting procurement and menus so that what is showing up on lunch trays is increasingly locally sourced, increasingly scratch cooked, increasingly responsive to the cultural identities of kids in that community. Those are the key areas for us as a collective to be working. And so that's where our measures really flow out of.
And I would just add in Kurt's idea of shift, I see not only this systemic shift, which is clearly how we as a funder are approaching our strategic funding areas, but also a power shift. So really by having the head of school food and nutrition services at the table as a key decision maker, by surveying students about their likes and their dislikes, we are attempting to shift power in addition to the community, to the stakeholders who really need to be the decision makers in this. And that power shift is something that I think is a little difficult for for some of us to really recognize. But for real change to happen, systemic change to happen, that power shift has to happen right alongside.
Maybe just to ask Kim one very quick follow-up into any of the three of you. What, as you look back at it, surprised you the most or delighted you the most in terms of those student advisors, the student interaction, as to what they offered or recommended, or how they engaged? Because that seems to be a central part of making this real.
I can kick us off because there's so many great outcomes, and we're working on our 10-year report right now, which we'll share with all of you once it's published in the next few weeks. But there are so many great outcomes from that. One is not so much the information that they shared with us, which, believe me, was incredibly valuable, around water access, quality of food, accessibility, enough food, not enough food, culturally sensitive, all kinds of data points that we all needed to hear and to learn from. But more important to me, just I guess personally, was on an individual level, the students who participated in these youth advisory councils over the years just blossomed. So we have anecdotes and quotes from both teachers and students about, a student being so quiet, she was intimidated to ever speak up until she joined this council and became a spokesperson for her grade and really just blossomed because she found her voice in this youth advisory council. Another thing the youth advisory council has done in the past few years is we've given them $25,000. So we've with a few of our partners have initiated a youth philanthropy program. So not only do they have a voice, but now they have some power and resources behind their voice to do mini grant making. So not only teaching them some of the concepts behind philanthropy, but really empowering them and teaching them about social change. So many great outcomes of working with these youth. And that work is, it's like reverse mentoring. It benefits us so much, maybe even more than it does the students, but really great individual outcomes for many of the student participants.
A couple of the other themes of questions that have come in the Q&A, and thanks to everybody for an incredible diversity and richness of questions. We're going to try to get through all of them and answer some online, others live. A couple of questions that have come up is with regard to your current activities, is what I'll call a sense of how have you coordinated with others doing similar things in the same communities? How have you avoided redundancies? So some of the key questions that have come in is, how have you coordinated and interacted with health systems who may themselves be implementing programs, writing prescriptions related to nutrition? How have you engaged with SNAP's ED and the obesity programs, with others very much engaged and involved around nutrition and some of the same concerns? So maybe if you could, someone could address that in terms of coordination and alignment.
I'm happy to kick us off unless Kurt or Nancy, you want to jump in? Shall I go? I can answer that question, and also a really good question. More in reflection on the past 10 years, because we just launched in October our Full Futures program. That coordination with other health system partners hasn't happened. It will happen. It hasn't happened yet. But in reflection on the past 10 years, one of the early things we did was a result of my going to a community fair in Camden, a health fair. And I learned that, this was maybe my first few months here, it was a Saturday, and I learned that Camden City didn't have its own health department. The Camden County Health Department was responsible for the city. And they brought a van in to these different community fairs to do health screenings. And I was talking to the person who was running the van and saying, how many screenings will you do? And she said, oh, we've never done more than 7. So we then worked with our Healthy Communities Collective and coordinated with the County Health Department to bring their health screening van to a corner store where we were doing nutrition education lessons. And we incented those lessons, participation in those lessons with $4 coupons that were redeemable that day. By the way, they had 98% redemption rate. And the first day there was a screening at one of these corner stores. They did 14 screenings. The second time, there was a line around the block. And that program is now a program that is embedded in Camden with the county health department and has had terrific outcomes as we get people screenings, get them more food resources, nutrition resources, health resources. So that was one great win, I think. Another one we had was around food insecurity screenings, which weren't being done by any of our healthcare partners 10 years ago, and now are being done in multiple healthcare sites across the community. We coordinate with our corner stores with both SNAP and WIC to the extent that we can within the state guidelines and laws for both SNAP and WIC. It's definitely something, and it makes me think, that question makes me think about we should be embedding some of those plans in as we think about year 2 for Full Futures, even though we've just begun year 1. But yes, there will be coordination to the extent that we can manage that with our healthcare partners.
I think the other dimension of it that I would lift up is systems largely are made up of people and relationships. And what I've found to be so powerful about this initiative has been the longevity of it and the willingness for a corporate partner to commit to a decade of work is exceptional. And then to follow up with an additional 5-year commitment that's even more focused, leaning into a particular area of opportunity within the original strategy. It lets us do the patient work of actually building relationships in a way that lets us move much faster now than we ever could have in the early days of the collaboration. I think the other thing I would lift up that both Nancy and the Wellness in the Schools team and FoodCore have been paying attention to is the fact that if we are paying attention to the people who are in the system, you really start to prioritize investment in local leaders who are going to play multiple roles over time within that system. And so in FoodCore's case, FoodCore alumni now are working at the Common Market, which is another partner in this next phase of the work together. That kind of connectivity is super important in the way Nancy was sharing the lead chef being from within the Camden City Schools as an alum. When you're investing for the long term and investing in people from within the communities where you are working, the system really starts to change because of the level of trust and relationship that is in place across all the different partners.
So maybe in follow-up, Kurt, to where you just took us, and thank you, Kim, for your comments. In the Q&A, there's a recognition that there are some other major collaboratives that are attempting to do some similar kinds of things in other areas, such as the New York Coalition for Healthy School Food and other collaboratives that are mentioned. So a couple of questions that the participants have for you is, first of all, where do you see your critical next stages? Where are you taking what's your vision for exactly for the next year or two, as to not only how to keep what you've done in Camden and the area, but what's your vision as to how you've talked at the beginning about the goal of replicating and scaling this model? So the participants are very interested in your thinking there, and even to ask whether you're ready to move internationally. So that is a question as well. So if you want to start with the US and then go to Latin America. But I think, just what the aspirations are, but what some of the takeaways for the participants as how you go from the kind of partnership that has worked so well locally to figure out how to implement it in many different and diverse school districts across the country.
Yeah, I'll kick us off and then turn it over to you, Kurt. But about the New York Coalition, who I'm sure, Nancy, you probably work with, I really hope that all of us doing work in this space can start to connect with one another. So it's not just the Camden collective working in Camden, but we all know what each other is doing and have some kind of network to share our learnings and experiences. If Mark Klaus, our CEO, were on this webinar, he would say his goal, which he reminds me of daily, is to create this blueprint, which FoodCore will talk to, because the idea is to take this program that we're doing a really deep ecosystem change, we hope, in Camden, to our other Campbell communities. There's 31 Campbell communities in North America, but also to share it with any community, be it a funder who wants to implement it, another business who wants to implement it, a group of nonprofits. We really hope to create resources in this blueprint form, and also process, because I think process is such a big part of what we're doing, to share open source. And that's one of the major roles that FoodCore is playing for us as backbone, is really thinking about how do we create this blueprint. So Kurt, I'll share.
Yeah, terrific. I mean, I think the key question in any blueprint creation like this is, where do you find consistency, which gives you replicability and scalability, versus where do you preserve adaptation, which gives you relevance to the different communities in which you're operating, different scales of school districts, different cultural realities of the politics or the folks who are represented in that system. As we think about what needs to be in the blueprint, there's important chronological work to think through in terms of who do you bring to the table and why, and making sure the right partners are actually convening and that there's real intentionality to why those partners have the unique individual genius that makes for a powerful collective combination. There's the question of, what do you need to see in terms of really serious district engagement? If we're trying to shift the system that ultimately is going to be owned by a school district day in and day out for the long term, what needs to be true about how they are showing up to know that they are a partner that wants to do this work and is ready to do this work, and that there's the degree of trust in place with the other partners at the table. And then a real definition around the backbone role and what is the right way for a backbone partner to show up in the context of this kind of collaboration, and what are the third rails we need to stay away from. In terms of the kind of next step chronologically, as you launch that process, how do you do that collective work of aligning on your shared logic model, getting to common outcomes that you are prioritizing, and really having relationships and trust and a shared agenda in place? Then how do you move next into the implementation mode? And what agreements do you have in terms of how you're going to continue to show up and continue to lean in with each other, while of course the world is changing and our organizations are all changing and we're all trying to figure out how to be responsive to the moment? What do we commit to continuing to do in our collaboration with each other? And how does the backbone role need to evolve, and how do the partners need to evolve as we learn, so that we're not just implementing a static concept, but actually being dynamic and recognizing that change needs to happen. And then how are we measuring success, and how are we telling the story of that success in a way that leverages it for larger scale transformation and replication and learning, so that the work we do doesn't stop in Camden, but actually continues on to other communities around the country.
Kurt, a real quick follow-up, and Nancy and Kim, I recognize you may have some follow-up comments, but a couple of questions that have come in, really twofold. One is, are there some examples as you've started to move into trying to scale and replicate and move into additional communities? Are there some examples of outcomes that have really resonated with communities, that they really themselves say, this is what we gained, or this is what we value? And then just a pragmatic question is, as you're choosing whom to work with and how to partner with and so on, how do you overcome the financial constraints that some school districts assuredly must have? Two very different questions.
Yeah. So the where we are in the replication process on the Camden initiative is we're building the blueprint, and we're figuring out what is the pathway towards being able to do this work in other communities. At the same time, as we're figuring that out as a collective, FoodCore is already on our end looking for ways we can take some of the things we're learning from the Camden experience and start having that show up in other places where we work. And so across our partnership network in the 14 states where we operate, we are in the process of building multi-year goal-driven partnerships with our district and community partners. And what we're finding is there's not a single measure that everybody is most motivated by, but there are themes to what the lenses are that our district and community partners are showing up with interests around. And that in some places looks like a health and wellness frame, and districts and communities that are very focused on public health are saying, great, how are we increasing fruit and vegetable consumption as part of the kind of food education and school meal work that we're collaborating on. In another district, the lens is actually more about belonging. It's more about the way that food is the currency of human connection, and the fact that food that is culturally responsive to the kids' communities in that particular place, food education that is culturally responsive to cultural traditions is hugely influential. Food is a community builder, and that still meets the health and wellness goals that another district might have, but the lens on it is different. And then in a third place, there's the kind of academic lens, which is like, how is this advancing math and science learning? How is this setting kids up so they are well nourished when they come into the classroom and able to do their best work? And how is food education and school meal programming playing out in a way that supports social emotional development of kids? So it's the same work in some sense in each of those places, but the lens and the measures people are keying off of looks different in different places. Nancy.
Yeah, I mean, I had a comment, I have from two comments back, which maybe I'll get to if it feels relevant, but I did want to say, I wanted to answer the most recent question, Meg, that you posed about where have we seen changes. And, most of the work in New York City, and most of the work of wellness in the schools has been based in New York City, and having, the almost 20 years of working in that one city and seeing the change, I would point out two very important changes, and this is pre-pandemic, but salad bars in New York City were a real, something that we saw change literally overnight. And it's one of the reasons why we were so sort of aggressive and emphatic about bringing that to Camden as well. And I saw the question about, health and safety, and to be fair, right now, there are no salad bars in New York City. We do have salad bars in some of the districts that we work in, not in Camden and not in New York right now, hoping to come back in January. But all of our organizations have different training components, whether it's salad bar rangers or the salad bar etiquette, where before we implemented the salad bars in the KIPP schools in Camden, we went into every single classroom and did training around how to use a salad bar. And it really, there was so much resistance in the beginning. We actually were doing a salad bar in an old milk cooler to meet the safety regulations with the coolness, but with the temperature. But anyway, after we launched that, the training in the one salad bar, they then put in two salad bars in one kitchen to serve all the need. But the point I want to make about New York is salad bars were a very big deal, and I'm forgetting the numbers, but I want to say at least, and there are 1,200 school buildings in New York City, and over 80% or more had salad bars pre-pandemic. And the second piece that I've seen so much shift in is culinary training of the New York City school staff. And again, through this collective work. An interesting thing about the collective work in New York and New York Coalition for Healthy School Food, I saw on the note, yes, they are part of it, is this has been not necessarily driven, but now sort of these partnerships have been hosted by the district office. So the district office is sending us, monthly updates and monthly meetings, and we're working together with the centerpiece being the district office, which is, and we all come with our own funding sources. So that's another very interesting model, and I would argue a very successful model, once again, to have that district office at the table. I wanted to mention Health School Food Matters in London. We have a great thought partner there doing great work. If anyone's, I know it was Latin America, but and then also just lastly, that it is a very small world, this school food world, the school nutrition world, and even those of us working in the world, move from one organization to another. And so we're continually helping and supporting each other because we know, to Kurt's point earlier, mostly egos are aside and we're all really working toward this common goal. So I've said enough, but I wanted to comment on a couple of different threads.
Well, as we're coming to a close here, let me kind of, while we're looking at the last few questions, and we will also have some follow-up, I wanted to give you all the opportunity to give some closing remarks, given this great set of questions and so on that have come in. And one overall question, what you have talked about that you've done already is remarkable. I think particularly this idea of creating a blueprint of what you've accomplished, thinking about how it could be adapted, replicated, and scaled, and then have this public-private or private-private partnership going forward with national leadership to try to impact as many communities as possible. And Kim, as you said, to be open source. Let me ask you, in terms of your role as a major leader for much more than a decade now, and as part of a national industry as well as corporation, what do you see the role and the power of that going forward? And what would you share with others trying to envision doing something similar, maybe in the same industry or other industries? And then your takeaways. Let me say to everyone on the audience that Kim, Kurt, and Nancy are willing to share their email, their contact information, so questions that go unanswered here can be answered. But Kim, let you, Kurt, and Nancy have the last word here.
Okay, great. And I'll do 60 seconds because I see we have 3 minutes left. To everybody listening, can we please create a movement? I mean, Campbell is a catalyst for this movement. We're one corporation. We need anyone who's interested, anyone who realizes the importance of elevating school nutrition in this country for all kids, not just for kids in communities that are not as able as other communities, for all kids. And let's start this movement, and let's have our health sector partners as part of this movement, our education partners, other funders, both public-private funders, government. It has to be a cross-sectorial partnership to do this. But if we could start a movement to really elevate the need for our children, we can start talking about social determinants of health and health outcomes in a much more holistic and positive way, I believe. So really, I think that Campbell is a catalyst in this movement to say, yes, we have a long-term commitment. Yes, we are a servant leader. We lead from behind. We want to listen to our district's needs, our community's needs. We want to transfer power and wealth to those communities, but we really want to push this movement along with my partners on the call, but all of you on this webinar. We want to push this forward.
Thank you, Kim.
Just to pick up where Kim left off, that vision for transferring power and wealth, agency to the communities, and as this initiative does, even to the kids at the center of this work, that's what it's about. And the question is, how do we support that in a way that is really responsive and adaptive to local needs and local priorities and the local stakeholders who need to be at the table in a given community, but with an eye towards what's working and with an eye towards replicating the parts of it that really can be cohesive and consistent and ladder up to national change. Because there's 100,000 schools in the country. There's 32 million kids who are counting on school meals for a meaningful part of their nutrition every day. This is the largest restaurant chain in America. If we want to make meaningful change on behalf of the next generation, we have to figure out how to do this in a way that is replicable and responsive at the same time.
I'll pick up on the national change piece and hopefully leave it in a even more positive note, because I do my peers have been speaking positively, even though this work is incredibly challenging. So in the last many years I've been doing this, I certainly have seen a change and interest. And so when Kim has her cry for help, it was an even louder cry 20 years ago. But I think also just on the federal national level, it's been a tough 4 years for many reasons, including a pandemic. But I think that the passing of the Build Back Better Act is something that helps us to move in a positive direction. That there's $10 billion for child nutrition programs that are included in the bill that are a long needed investment in the health and well-being of our nation's youth, and in particular, the $30 million for scratch cooking, technical assistant, and school kitchen equipment grants that will really help to ensure, as Kurt so beautifully described, that every child has daily access to highly nutritious meals at school, because it really is not a privilege. It's a right. So Kim has said that many times.
Great. Well, thank you, Kim, Kurt, and Nancy, for your leadership, your initiative, your absolute unflagging energy and commitment, and your passion about this. And from all of us in the collaborative, I'm sure everyone on the call and everyone that you've touched, you've, I think, reminded us that, you know, the folks most affected by the pandemic are children. And your initiative is not limited to one child, it's every child everywhere. So thank you so much for what you have done, and particularly for the excitement that you've shared with us as to where you're going in the future. And hopefully you can turn to us if there's anything more we can provide. And to everyone that participated today, thank you. The contact information will be available. The slides are already on the website. The recording will be made available, and we will all keep in touch. But thank you very much for all that you've done.
Thanks
you,
for
Meg.
having us.
Thank you, Bob.
Yeah, thanks to all of you. Thanks, Kurt and Nancy.